We are experts at dealing with people with very serious medical conditions along with kidney failure, especially those with kidney failure having complications such as heart failure, septicemia or blood infection, brain problems, liver problems, heart problems, as I said. They are very, very sick and they need to be in the ICU. Our ICU has 24/7 coverage by intensivists around the clock, and we specialize in doing dialysis for such patients whose blood pressure is very low. They are in what is called septic shock, and they are put on a special type of dialysis called CRRT, that is continuous renal replacement therapy, a special treatment which is basically bedside, done 24 hours round the clock for 3 to 4 days till the patient stabilizes, and we are able to get them out of this serious medical problem. So our intensive care nephrology treatment is one of our specialty, and we were one of the first in this region to start the CRRT treatment way back in early 1990s, where we saved a number of lives in the intensive care who have had major multi-organ dysfunction syndrome. It is called MODS, where not only the kidney, but in addition to the kidney, the liver, the heart and the brain are not functioning properly. The other area in the intensive care and outside the intensive care is those people who have other problems other than kidney problem and need complicated surgery. I'm talking of a patient, for example, has a chronic kidney disease, and in addition to that might have additional problems like the heart or the brain or the hip or the knee. Or for example, if a patient has a creatinine which is increased to about 3 or 4 and they need a total hip or a total knee replacement, generally most hospitals do not take up such cases because they have high risk cases. We specialize in taking care of such patients and make them go through this. We recently performed a very highly complicated bariatric surgery where the patient was about 170 kgs of weight, had chronic liver disease with cirrhosis, and was on dialysis. So after preparing the patient for about 15 days, we were able to do this bariatric or obesity surgery, and successfully after the surgery the patient's creatinine, he's off dialysis and his creatinine has come down to 4 and the liver disease has improved. So you can see this high risk bariatric surgery, according to me, has never been performed anywhere in the country. So this is just an example. We also have performed numerous hip replacements and knee replacements in patients who are on dialysis, who normally are not operated by ordinary hospitals because they do not want to take the high risk. We do this very successfully, and the rule that I go by is that there is absolutely no surgery in the world which cannot be done on a kidney patient if it can be done in a normal person without a kidney problem. In short, what I mean is, if anybody has a kidney problem, he can undergo any surgery which a person without any kidney problem undergoes, like a normal person. If a normal person can have hip replacement, normal person can have bariatric surgery, then also a patient on dialysis or CRRT treatment is doing dialysis like treatment for the critically ill patients whose multiple organs are damaged. We did the first CRRT in the state of Andhra Pradesh way back in 1992. We saved hundreds of lives using this form of treatment. So you can consider our center to be a pioneer in the treatment of continuous renal replacement therapy, which is a full form of CRRT. We have done the maximum number of CRRT per year consecutively for many years.